Did you know that your liver works non-stop 24 hours a day, 7 days a week, performing more than 500 vital functions without you feeling anything at all? He is the true silent hero of the human body. However, there is a hidden danger in all this efficiency. Because it is an incredibly resistant organ, the liver rarely complains or sends clear signals in the early stages of an aggression. I'm Dr. Michael Carter, and today, I'm going to talk about the 7 signs that your liver is crying out for help. If you like this type of content and want to learn how to protect your health, subscribe to the channel and activate the bell. Often, when a person finally realizes that something is wrong, the liver damage is already at a very advanced stage, with much of the organ's capacity compromised. The big question is your body already trying to send you little alerts that your liver is overloaded, while you continue to ignore these signals and think it's just a passing fatigue or day-to-day stress? In today's video, we'll unravel in detail how this fascinating organ works and look at the 7 most important signs that indicate your liver may be crying out for urgent help. To truly understand the importance of paying attention to your body's signals, we need to first understand the central role the liver plays in your survival. Think of your liver as the largest recycling plant, chemical laboratory, and filtration center in the human body. Every minute, about 1.5 liters of blood passes through it to be purified. The liver is responsible for filtering and neutralizing metabolites, medications, alcohol, and environmental toxins. In addition, it synthesizes bile, an essential fluid for the digestion and absorption of fats and fat-soluble vitamins that you consume daily. It also acts as the body's main energy store, storing glycogen to be released when your blood sugar levels drop, and it produces the most important proteins in the blood, including those responsible for blood clotting and body fluid balance. The big problem is that the liver tissue itself does not have direct pain receptors. This means that, unlike the stomach, which quickly complains with a heartburn or twinge, the liver does not hurt when it begins to accumulate fat or suffer chronic inflammation. Pain or discomfort only arises when the organ significantly increases in size and begins to stretch the fibrous capsule that surrounds it. Unfortunately, the modern routine, full of ultra-processed foods, excessive consumption of refined sugars and industrial fructose, sedentary lifestyle, frequent consumption of alcoholic beverages, and indiscriminate use of medications, imposes a continuous overload on this filter. Over time, liver cells begin to accumulate fat, enter an inflammatory process, and begin to lose their efficiency. It is exactly at this point that the body begins to manifest subtle signs that the machine is failing. Pay close attention to the first 3 signs, as they represent the most subtle and initial warnings of liver overload, ones that most people often ignore or mistake for skin problems, stress, or lack of rest. The first sign is a persistent and diffuse itching of the skin without any apparent cause or visible lesion. We are not talking about a common allergy, insect bite, or dry skin. When the liver has difficulty processing or excreting bile, a condition called cholestasis, bile salts begin to accumulate in the bloodstream and end up depositing under the tissues of the skin. This deposition stimulates the skin nerve endings, generating an uncomfortable and continuous itching sensation that does not improve with the use of moisturizing creams, ointments, or conventional antihistamines. The second sign is extreme tiredness, physical exhaustion, and constant mental fog. It's that feeling that, even sleeping 8 hours a night, you wake up feeling like you haven't rested at all, accompanied by persistent difficulty concentrating, memory failures, and slowness in thinking. As the overloaded liver cannot properly neutralize and eliminate toxins and metabolic waste from the blood, these substances remain circulating in the body and directly affect brain function and energy production by cellular mitochondria. The third sign is frequent bruising and bleeding that appears easily. If you notice that any light bump on the corner of the table leaves a huge purple mark on your skin, or if your gums start to bleed frequently while brushing your teeth, be extremely attentive. The liver is primarily responsible for making the essential proteins of the blood clotting cascade. When liver function drops, the production of these proteins drops with it, causing the blood to take longer to clot and the blood vessels to be more vulnerable to small extravasation. As the degree of inflammation and organ impairment advances, the signs are no longer subtle and start to manifest themselves in a more evident and worrying way in the body, requiring immediate medical investigation. The fourth sign is visible swelling in the legs, ankles, and increased abdominal volume. The liver is the unique factory of an abundant protein called albumin, which acts as a kind of sponge inside the blood vessels, keeping water inside the circulation. When the liver becomes ill and albumin production decreases, the oncotic pressure in the blood drops, causing fluid to pull out of the vessels and accumulate in the surrounding tissues. This causes swelling in the lower limbs and can lead to fluid buildup inside the abdominal cavity, a condition known medically as ascites. The fifth sign is the marked change in the color of urine and feces. If you notice that your urine has turned a dark, concentrated color, similar to black tea or cola, even when you're drinking plenty of water, this indicates excess bilirubin being filtered by the kidneys. At the same time, if your stool loses its usual brown color and becomes whitish, grayish, or clay-like, it means that bile is not able to reach the intestine to digest food and give the stool its normal pigmentation. The sixth sign is a continuous discomfort, feeling of heaviness or mild pain on the right side of the abdomen, just below the ribs. As we mentioned, liver tissue doesn't hurt, but when the liver suffers from excessive fat accumulation or chronic inflammation, it increases in size, a condition called hepatomegaly. This swelling stretches the Glisson capsule, the sensitive membrane that surrounds the organ, generating constant pressure or an uncomfortable feeling of fullness in that region. The seventh sign, and the most classic and serious of all, is jaundice, characterized by visible yellowing of the skin and whites of the eyes. Jaundice occurs when the liver loses the ability to process and metabolize bilirubin, an orange-yellow pigment resulting from the natural destruction of old red blood cells. With the liver filter stopped, bilirubin accumulates at dangerous levels in the blood and deposits in the body's tissues, especially the eyes and skin. Jaundice is a red warning sign that requires medical evaluation with the utmost urgency. Despite all these worrying warnings, there is extraordinary news about the human body. The liver is one of the very few organs with a spectacular capacity for regeneration. If the aggression is stopped in time, before irreversible scars known as cirrhosis form, the liver tissue can recover, renew its cells, and return to function with full efficiency. But what can you do in your daily routine to protect this precious organ? First of all, reformulate your diet consciously. The great villain of the modern liver is not only the fat in food, but mainly the excess of refined carbohydrates, sugars, and high fructose corn syrup present in soft drinks, industrialized juices, sweets, and ultra-processed foods. Excess fructose is metabolized exclusively in the liver and rapidly converted into liver fat. Prioritize real food, cruciferous vegetables like broccoli, kale, and Brussels sprouts, rich in sulfur compounds that stimulate the organ's natural detoxification enzyme. Secondly, maintain an excellent level of hydration throughout the day. Water is the fundamental vehicle for the kidneys and liver to process, dilute, and eliminate toxins from the body fluidly and without excessive effort. Third, severely moderate or eliminate alcohol consumption. Alcohol is a direct toxin to liver cells, requiring an outsized metabolic work of the liver and generating highly inflammatory byproducts during its breakdown. Finally, be extremely careful with self-medication and the indiscriminate use of supplements or teas without guidance. Frequent, uncontrolled use of common painkillers, anti-inflammatory, and even certain concentrated herbs can cause a serious condition known as drug hepatitis. Remember that absolutely everything you eat needs to be processed by your liver. Understanding how your body works and learning to interpret the small signals it sends daily is the most fundamental step to prevent serious diseases and ensure a long, healthy, and high-energy life. Knowledge is always our best prevention tool. It is worth mentioning and reinforcing that all the content of this video is strictly educational and informative. It does not replace, under any circumstances, a consultation, diagnosis, or professional medical follow-up. If you have identified one or more of the signs described throughout the video in your own body, in the routine of someone close to you, stay calm, but don't leave it for later. See a general practitioner or a gastroenterologist. Through simple routine blood tests, such as the measurement of GOT, TG, gamma-GT, and bilirubin, combined with an abdominal ultrasound, the specialist will be able to accurately assess the health of your liver and guide the best path. If today's information was useful and helped you better understand your health, don't forget to leave yours liked, subscribe to the channel so you don't miss our next videos, and share this content with your friends and family. Taking care of those we love is also sharing quality knowledge. See you in the next video.